Video case report. Endoscopic treatment of sigmoid volvulus. Endoscopic treatment of sigmoid volvulus. An 8-year-old man presented with abdominal pain and distension, with no evidence of peritonitis on examination. Past medical history included previous sigmoid volvulus treated with endoscopic detortion, palliative treatment of head and neck cancer, ischemic cardiomyopathy. Those images correspond to a previous endoscopic detortion of sigmoid volvulus 3 months ago. This patient was not candidate for surgical resection because of severe comorbidities. A CT scan was done to exclude other causes of obstruction. We can observe a distended sigmoid loop with an inverted U position. This is the cough bean sign. In addition, we can notice a beak-shaped transition on sigmoid loop. Laboratory exams showed normal values for white blood cell count, serum C reactive protein, and electrolytes. Water immersion technique is an option for sigmoid volvulus treatment. This can be done with unsedated patients. In this case, this is a good choice because of poor clinical conditions. First, we notice a torsion in the sigmoid column, which is the classic real sign. The procedure was initiated with a standard colonoscope, equipped with carbon dioxide insufflation and water pump. No air insufflation was used. The second attempt was done inserting a guide wire across the volvulus, with a gentle push to pass the scope through the volvulus. In the third and final strategy, the guide wire was left in place and the colonoscope removed. A gastroscope was inserted over the guide wire, with assistance of an ERCP cannula. After passing through the point of obstruction, the colon was decompressed, with endoscopic detortion of the volvulus. The colon mucosa presented ischemic areas with necrosis, without signs of perforation. A rectal tube was left in place. After endoscopic decompression detortion, there was a significant relief of the patient's pain and abdominal distension, with no signs of peritonitis. The oncology and surgical staffs, in accordance with the family, decided for palliative treatment with no surgical intervention because of poor clinical conditions and advanced metastatic neoplasia. The patient had fluid and electrolyte disturbance with worsening of renal, pulmonary, and cardiovascular conditions, and died 1 day after endoscopic intervention. Endoscopic detortion is a temporary measure for sigmoid volvulus treatment because of high recurrence rate. This video illustrates tactics in decompression detortion of sigmoid volvulus.